Good day everyone. My name is Tasic Baltazar and my assigned topic is types of physical disabilities. So, physical disabilities refer to impairments that are temporary or permanent, affect the bones and muscle systems, and make mobility and manual dexterity difficult and or impossible. Cause deformities and or absence of body organs and systems necessary for mobility, and affect the nervous system, making mobility awkward and uncoordinated. Orthopedic and neurological impairments. The two distinct and separate types of physical disabilities are orthopedic impairments and neurological impairments. And orthopedic impairments affects bones, joints, limbs, and associated muscle of the skeletal system. Cerebral palsy. Cerebral palsy is characterized by disturbances of voluntary motor functions that may include paralysis, extreme weakness, lack of coordination, involuntary convulsions, and other motor disorders. So first, hypertonia, commonly called spasticity. This is characterized by tense, contracted muscles, and the movements may be jerky, exaggerated, and poorly coordinated. Hypertonia is a condition in which there is too much muscle tone so that arms or legs, for example, are stiff and difficult to move. Muscle tone is regulated by signals that travel from the brain to the nerves and tell the muscle to contract. Hypotonia, weak floppy muscles, particularly in the neck and trunk. The child with hypotonia has low level of motor activity, slow to make balancing responses, and may not walk until 30 months of age. Hypotonia is a medical term used to describe decreased muscle tone. Normally, even when relaxed muscles have a very small amount of contraction that gives them a springy feel and provides some resistance to passive movement. Atitosis, it is a condition characterized by slow, worm-like involuntary, uncontrollable, and purposely movements. A slow, continuous, involuntary writing movement that prevents maintenance of a stable posture. Atitosis involves continuous smooth movements that appear random and are not composed of recognizable sub-movements or movement fragments. Spina bifida. Spina bifida is a congenital defect in the vertebrae that encloses the spinal cord. Number 1. Spinal cord injuries. Spinal cord injuries are a result of accidents. Spinal cord injury is damage to the spinal cord that results in a loss of function, such as mobility and or feeling. Frequent causes of spinal cord injuries are trauma, car accident, gunshot, falls, etc., or disease, polio, spina bifida, Friedreich, ataxia, etc. Traumatic brain injury. Traumatic brain injury is commonly caused by injuries to the head as a result from automobile, motorcycle, and bicycle accidents, falls, assaults, gunshots, wounds, and child abuse. Traumatic brain injury is a disruption in the normal function of the brain that can be caused by a blow, bump, or jolt to the head. The head suddenly and violently hitting an object, or when an object bursts the skull and enters brain tissue. And there are three types of seizure. So first, generalized tonic-clonic seizure. Generalized tonic-clonic seizure, formerly called grand mal, is the most conspicuous and serious type. The affected child has little or no warning that a seizure is about to occur. The muscles become stiff, the child loses consciousness and falls to the floor. Then the entire body shakes violently as the muscles alternately contract and relax. Saliva may be forced out of the mouth, legs, and arms may jerk, and the bladder and bowels may be emptied. After about 2 to 5 minutes, the contractions diminish, the child either goes to sleep or regains consciousness in a confused or drowsy state. This type of seizure may occur as often as several times a day or as seldom as once a year, and more likely to occur during the day than at night. Second, absence seizure. Absence seizure previously known as a petit mal, is far less severe than the generalized tonic-clonic seizure, but may occur more frequently, as often as 100 times per day in some children. Usually, there is a brief loss of consciousness lasting for a few seconds to half a minute. The child may stare blankly, flutter, or blink his eyes, her eyes grow pale, or drop whatever he or she is holding. Teachers mistake him or her as they're dreaming or not listening. Lastly, partial seizure. Partial seizure, which could be complex or simple. A complex partial seizure, also called psychomotor seizure, may appear as a brief period of inappropriate or purposely activity. The child may smack his or her lips, walk around aimlessly, or shout, or she may appear conscious but is not actually aware of the behavior. A partial seizure happens when unusual electrical activity affects a small area of the brain, when the seizure does not affect awareness. It is known as a simple partial seizure. Simple partial seizure can be motor affecting the muscle of the body, sensory affecting the senses. Hemophilia is a rare hereditary disorder in which the blood not clot as quickly as it should. Hemophilia is usually an inherited bleeding disorder in which the blood does not clot properly. This can lead to spontaneous bleeding as well as bleeding following injuries or surgery. So burns result from household accidents but sometimes caused by child abuse. Children with serious burns usually experience pain, scarring, limitation of motion, lengthy hospitalization, and repeated surgery. Serious burn can cause complications in other organs, long-term physical limitations, and psychological difficulties. The disfigurement caused by severe burns can affect a child's behavior and self-image. Administration of special education. 4 administrative models are appropriate for this group of children. So first, inclusion in the regular class. This setting advocates for inclusive education, mainly mainstreaming and full-time replacement in regular classes. So inclusion classrooms are a staple in schools across the United States today. In short, inclusion in the classroom means that students with disabilities have opportunities to learn in the same environment and alongside non-disabled students. So number 2, special class. The special class is composed of children with disabilities who do not meet the criteria for inclusion in the regular class, while the special education teacher handles the class. Partial mainstreaming in regular classes may be worked out. They may be located in the special education center or special education resource room in the regular school or in special schools. So number 3, hospital-bound instruction. So the special education program of the hospital admits children with physical disabilities or chronic illnesses who cannot study in regular schools. The National Orthopedic Hospital or NOH, located in Quezon City, has a school for crippled children that offers educational services from the elementary to the secondary level. The Philippine General Hospital in Manila has a ward known as Silahes ng Kasulugan that caters to children who are suffering from chronic illness and diseases. So number 4, homebound or home-based instruction. So children who have severe or multiple disabilities, mobility problems, or chronic illnesses are regularly visited by itinerant special education teachers in their home who provide instruction based on their needs and capabilities. In case a SPED or SPED teacher is not available, the parents can provide direct instruction or hire a teacher to provide regular instruction. The knowledge and skills learned at home or in the hospital can be accredited through the Philippine Educational Placement Test or PEPT of the Department of Education. Assistive technology. The United States Congress defines assistive technology as any item, piece of equipment, or product system whether acquired commercially off the shelf, modified or customized that is used to increase, maintain, or improve the functional capabilities of individuals with disabilities. Students use assistive technology so that they can access the same educational opportunities as their peers. So first, mobility aids are assistive technology devices that help people perform movements in a variety of environments. These include manual and electric wheelchairs, canes, scooters, walkers, vans, modified for travel, electronic direction, finding, or mobility aids and other adaptations and devices. Number 2, setting and positioning aids are used to position the disabled person in the best posture to participate in a particular activity. The activity might involve moving from place to place, sitting during conversation, eating, sleeping, and others. Number 3, aids for daily living are devices used to increase independence. They assess an individual in performing functional living skills or self-help activities such as cooking, eating, bathing, toileting, dressing, and home maintenance. Number 4, communication aids include devices such as speech synthesizers, text-to-speech software, and telecommunication for the deaf. So number 5, sensory aids are assistive technology devices for students who have primary disabilities as hearing impairment and visual impairment. So sensory aids include a range of equipment and toys that provide auditory, sound, visual, sight, olfactory, smell, proprioceptive, movement, touch, and oral taste stimulation. They can help to promote brain activity and motor skills or be used for relaxation and therapy. Number 6, instructional aids refer to the devices and adaptations to materials that help facilitate an individual's learning. So, instructional aids are used in the classroom to encourage learning and thereby make it easier and interesting. The materials like charts, maps, models, concrete objects, film strips, projector, radio, television, etc., which help a teacher for effective teaching may be called instructional aids. That's all for my today's topic. I hope you learned a lot. Thank you and God bless.